Hey folks, it's Patriot Nurse, and in today's segment I want to share with you some of the things I have in my car medical kit. And there are different aspects of the medical kits that I carry, but what I want to show you today is basically the trauma kit that I carry. And my trauma kit is built around basically dealing with gunshot wounds and other traumatic wounds, like coming across a motor vehicular accident on the interstate or wherever. But I spend a decent amount of time around weapons and around guns, and if you do, then you might want to consider this as part of your trunk medical kit as well. So I'm not going to go over everything that's in here, but basically some of the big points that I want to give you guys are, number one, if you do not carry a tourniquet, you need to. Especially if you strap on a gun every day, you need to be able to deal with the aftermath of getting in a gunfight, God forbid. So the tourniquet that I have here, that's featured here, is a cat tourniquet, okay? There are different tourniquets, and there's a soft T wide. The cat I roll with because to me it's the simplest to use under stress, and in the words of Carrie Davis, simplicity under stress is a good thing. So I'll put a link down in the description box below as to this particular tourniquet. But the cat basically is pretty simple. Has a Velcro base here, and you have a windlass that you just wrap, and you crank it around and you secure it until you have occluded blood flow downstream. I also have in here airway components, basically things here to manage an airway. I got MPAs here. I also have a needle for decompression of tension pneumothoraxes, and these major items, I'll put links down in the description box below so that you guys can find them online and look around and see if you have need of them. But also I have an oral airway and the NPA, the nasal pharyngeal airway. I got different needles here. Also got fluids here for dealing with IV stuff. Another thing that you might want to consider as part of your everyday carry, certainly if you haven't already, is Quikclot combat gauze. And the role of Quikclot combat gauze is that sometimes for different reasons, basically you need to be able to pack the gauze into a particular wound. And the nice thing about the Quikclot combat gauze is that you've got two different methods or mechanisms in the combat gauze to help control bleeding. First off, you have the gauze, which you're plugging into the wound, that helps facilitate coagulation. It's a matrix, right? So you've got a physical component here, the gauze, to help the blood collect and to form a nice good clot. And then also you have a hemostatic agent, which is basically, in different cases, it's different types of chemicals and different derivatives to help the clotting process, to help the blood go down. I have a few other things here. Got H bandages, and I also have a pulse oximeter, and I'll put a link down in the description box below. Pulse oximeters are pretty cool. Basically, you crank this thing, you put this on the finger of a person, and it tells you two things. Number one, it tells you the oxygen saturation of the person, which is how effective their red blood cells are at harnessing and carrying oxygen to the rest of the body. And then also it tells you the person's heart rate. And if you're in a dicey situation, it's really nice to have that instant feedback, that instant readout, so you don't have to stop and feel for a pulse and try and get a pulse downstream. It's a good thing to have. It's a good piece of equipment to have in general. Also here I have some safety pins. In the case of airway compromise, sometimes people's tongues will block the free flow of air through the oral passageway, and the role of the safety pin is to be able to pierce through the tongue and to clip it down to make sure the tongue doesn't fall back. So these are just a few of the things that I wanted to show you guys. Okay guys, so what I want to do here is to show you how I have things organized and why they're organized the way that they are. First things first, on the front of the pack, the first thing that I have access to is a quick release tourniquet here, okay? The rationale behind this is that most people who die from gunshot wounds, they die because they bleed out. A major artery is hit and the blood goes out of the body, and the person, they die that way. Basically, they lose all of their insides. And so having a tourniquet readily accessible, that's really important first thing. So that's why the tourniquet is, and I've just attached them here on the loops here. I've attached them with rubber bands so that way I can rip them off and go. Okay guys, so the tourniquet's on the outside here, readily accessible. On the inside here, let's look at the contents of the bag. I'll show you the top part here, that's the airway portion, but what I'm most concerned with is the bleeding. Again, most people who die from gunshot wounds, they die because they bleed out secondary to having a major artery hit. The things that you'll notice that I have down here, I've got the hemostatic agents here. We got the Celox applicator, and then also the Quikclot combat gauze. Okay, again, the role of Quikclot combat gauze is that when you're packing a wound, you're going to pack it, and you're allowing a two-pronged matrix here. You're allowing for the gauze to facilitate coagulation of the blood, and then also the chemical agents present in the Quikclot are chemically, they're helping the blood to come together. Okay. So I've got some hemostatic agents here. Also, you will note that I have different bandages here. I've got a trauma bandage here, and then I have another one set here from a North American Rescue, and this is just a NARP emergency trauma dressing. Okay, so the whole point here is that we have things set up so that the black swan scenario of somebody bleeding out, all of my equipment is here, it's easily accessible, and it is categorized based on what system I'm working on. Okay. And then the pulse oximeter is down here because if you've got somebody who has lost a decent amount of blood, you need to kind of get that thing on pretty quick after you have stopped the bleeding. Stopping the bleeding is most important. Now let's look up here to the respiratory section. This would be the breathing category up here. I've got chest seals that are down here in this little zipper pocket. But also I have NPAs, nasopharyngeal airways, and I have the needles for decompression of tension pneumothoraxes. Most of the time that people are going to have issues, again, it's going to be related to breathing, but I want to set up my gear to facilitate dealing with stuff as it arises. I've also got in here, I've got some nitrile gloves, and back in here, I've also got some crack lights here. Now some people might ask, why do you have crack lights? Well, when it comes right down to it, I don't know the situation that I'm going to be in, and it may very well be that I'm having to care for someone in less than optimal lighting conditions. So being able to crack this open and see what I'm doing might very well help me in a dicey situation. So I also have catheters here. Got 18 gauge catheters and 14 gauge catheters for getting the line in on somebody, but also it can facilitate further decompression of the tension pneumothoraxes as well. Okay guys, so I'm sure a lot of you are wondering, what is this pack that she's got and where do I get one? Well, this is from Tactical and Survival Specialties, and I'll put a link down in the description box below for y'all. It's a pretty good setup. I've been very pleased with it. It's set up like a backpack, so you can just throw this stuff on your back and run. This was actually given to me by a friend who's an 18 Delta, and the neat thing about the bottom compartment here, it zips open and you can put other essentials in there that you like. What I have is a collapsible ambu bag, so this is the thing that you put over people to help them breathe, and then also have a blood pressure cuff in here. But you can put whatever is in your mind the most necessary down in your kit to tailor it to your own personal needs. So that is it, guys. That is a very brief rundown of what I keep in my trauma kit in the car. I hope today's video was helpful for y'all. If you did enjoy the video today, please subscribe to me, like me on Facebook, and follow me on Twitter. Also, if you're interested in learning more about how to take care of your family in difficult times, come out to class. Medical Prep 101 and 201 are taking place all over the country. Check out the full schedule at the website, thepatriotnurse.com. Hope it was helpful for y'all, and for now, it's Patriot Nurse signing off, and I will see you guys later. Bye.